I'm Gliding Wong, joining you from the San Francisco Bay Area from KTVU, and I'm joined now by Dakai, who is a professor of computer science and engineering at the University of Science and Technology in Hong Kong, also a distinguished research scholar at UC Berkeley in the International Computer Science Institute. You have some interesting work that that's been a big talk around the community and the world when we're talking about masks. Thanks so much for joining us.
Oh, pleasure to be here. Thanks for having me.
So the big think right now is in terms of masks, and as people require them and they wear them, and are they effective? You know, this is something that you really kind of wanted to dig into from a very scientific perspective.
Absolutely.
How complicated is this? Because there's so many different factors going into
Yeah,
this.
I mean, the thing that's been confusing is that there's a lot of research that hasn't been done on which exact types of masks have what properties and so forth. And so, like, people have been getting hung up on the question of, well, until we settle this, we're just not going to say anything. And that to us seemed really odd, because since I do see both ends regularly of both Hong Kong and Berkeley, you know, we see very different things. Hong Kong has had now for 23 days, no local transmissions, and very few cases that were imported. It never sort of went up the exponential pandemic spread curve. And at the same time, in Hong Kong, already in January, people were listening to the WHO warnings, and just as with Taiwan and Singapore and Japan and many East Asian countries, people would mask up. And 99% of people in Hong Kong walking around outside with other people are wearing masks voluntarily. It's not
it was
a
an
regulation.
easier transition, right? Because SARS and different things that have affected the East Asian countries, that they've already gone through what I think the US is going through in terms of trying to get used to it. It's a hard thing. Most of us didn't have masks in our house where we could just grab them and go to the store with them.
Indeed, and this is one of our, you know, sort of like human unconscious biases, is that there are familiar events recently that we anchor our expectations to. And so people out in East Asia were familiar. Oh, yeah, we took the brunt of the SARS episode. We learned the hard way. Masking is a good idea. And so this was relatively easy to do. And you know, the thing is, people don't necessarily worry about the question of, well, exactly which model and make or homemade mask is going to have which properties. We just realize, well, get the best masks that you can and wear them. And everybody has to wear them, because you're protecting, it's not yourself that you're protecting your community, you're protecting other people from your transmissions.
Why do you think it's been so hard, though, for the transition, given that other countries like Asia have gone through this and have seen impacts from it? The messaging has been confusing from everyone, from the WHO to the NIH. I mean, it's not, it has been a back and forth. First, don't wear masks, just wash your hands. Then do wear masks, but then we had a mask shortage. But then now any mask will do, you know, and it's understandable why people, I think, here are hard to convince now when you're trying to get them to wear masks, because all that messaging has been so different. Why has it been so different in your perspective when you're talking about other countries that have already seen
Absolutely.
positive results?
Yeah, I think in the beginning, the narrative sort of went off the wrong way. So the narrative was entirely about which masks protect yourself the best.
Mm-hmm.
And you still see that today, right? And we don't know, because people haven't systematically tested all the masks yet. And so that then caused people to, like, you know, there was a rush on really high quality masks, N95, so forth.
Things that, right? Medical grade masks. Right.
Or medical workers who cannot not have the PPE, right? And so that created a major concern at WHO levels and so forth, that if they advise people to wear masks, that there'd be run on that, and there wouldn't be enough PPE for the people who really need it in the medical and emergency services. And so that muddled the message. And it took a long time to recover from that narrative. We're still doing it now. We're still trying to get people to understand, no, for non-medical, ordinary, everyday, what we're trying to do is protect other people from you, and not to protect yourself from the other people as much. And so that conversation has taken time to seep in. Once you get there, then people understand, oh, yeah, this is no longer about taking PPE away from medical workers who need it. This is about taking the 10, 15 minutes it takes to make a mask at home out of old t-shirts and paper towels or some other better paper filtration thing. I think there is some concern that if it's just a cloth mask without any filters, it might be still too penetrable by aerosolized virus-bearing droplets. And so it is a really good idea to go find the directions for making cloth masks where the cloth is actually holding a
Right.
stronger paper
Holding
filter.
something in. Well, I think that it is confusing. I mean, I saw a graphic that said, vacuum cleaner bags are really the best. I'm like, well, no one can breathe through a vacuum cleaner bag, so I don't know how helpful that is, and for all of us to be cutting up those, vacuum bags and making masks out of them. So then we're going to go through this mask simulator that you created, but tell me about the science behind it. What were you trying to prove in the overall big picture of whether you're putting on, a mask made out of an old t-shirt versus something that you're buying online that has those carbon filters? Like, it seems to me that you're taking all of that into account when you created this simulator.
Yeah, I think with the simulator, it can be very non-intuitive for non-specialists why this kind of masking and other NPIs help to cut down on the exponential spread, where we're used to dealing with things that are more linear, and exponential spread and the complex dynamics are not intuitive. And so when you can have a simulation be visual and you can just see what's going on, and the colors help you to notice when people are spreading things, then it becomes much more tangible and concrete, right? This is not it's not a political discussion. We're just trying to protect our own communities, right? And just as good neighbors everywhere are trying to look out for their neighbors, we are focusing more on just how we can understand the impact upon protecting of our neighbors.
Okay.
And
Yeah,
you
that
can,
makes sense. So
yeah, and in the simulator, we wanted to give people a way to build in their own assumptions about how effective the masks were. So if you build, I mean, let's say you decide, I'm going to make a mask out of fishing nets. Okay, it's going to have very low
that's an option.
efficacy, and I can set the parameters to that, and and see what happens, right? And so
Okay,
you
so
can
yeah, let's bring it up in terms of just in general, so people can kind of see what we're talking about, and then maybe get a better idea of what we're looking at. This is one of your YouTube videos. You explain, the need for it through this graph. Explain what we're looking at here as we kind of go through it, because there's several lines here. You got the blue one,
yeah,
that's
these are
most of us.
this is a standard way of representing um, uh, what is happening over time. So that the axis there is the number of days, up to 250, 300 days. And in epidemiology, we typically, there's variations, categorize people into initially susceptible. And if we let that run a little bit, that's the blue line there. Then the green line is, well, okay, so the orange line is people who have now been exposed. The red is people who have been exposed and they've passed their 5 to 14 days of incubation, and they've become infected and infectious. So
Okay.
now they're contagious. And then after some period, they 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 stop being infectious. And in epidemiology, typically we just say they've recovered, but if they've passed away, we also put them into that category because they're no longer infectious.
So are
So the
these
four
lines that we're
categories.
looking at right now, these are no masking is how it looks?
Yes. So the shape of the curves here is pretty much the most standard model right now. It's calculated by what's called the SEIR model, and the parameters in it are sort of the accumulated wisdom of the worldwide scientific community.
Okay.
So what we're looking at here are the baseline curves where what we know about the incubation period and the transmission rates of the virus and so forth are then built in, and without other interventions.
Okay.
And what we want to do is compare the effect of masking against that baseline case.
Okay.
Um,
So we look at the
and
100-day mark. Is that the where it looks like the biggest
so,
change? That's a pivot point,
yeah,
right?
I mean, this is just, we can see at about that point in time, you've got the majority of the population having been exposed already. And you're sort of seeing the hospital load at its peak. That's the red line. So these are people, some fraction of which are going to be loading down our hospital system. So when people talk about flattening the curve, they're talking about how do we keep that down to a manageable level so that we actually have the facilities to treat them instead of what we saw happen for example, in Italy.
Okay.
Um,
And so when we're looking, you know, at that situation, it's just putting it all kind of in perspective in terms of what we're trying to change. I mean, that the flattening the curve, everyone knows that term
mhm,
oh so well these days.
mhm.
um, so when we go back to the simulator, I mean, you can put in a lot of different parameters. We'll pull this up now. This is the simulator in terms of, here's that graph that we just looked at. Tell me what
Mhm.
these green dots are, then, and those correspond with the lines then, right?
Those correspond to the green curves, right? So this is coming to the end of a simulation run already, almost 300 days. And
Okay,
so almost
we got to start
everybody
that
has,
over. Yeah. Let's start that over. And then this is how we control it, right? To be masking,
yeah.
and where should we set that?
So we could set that to say, 90 or 100%, and that would represent that people have started on day zero already all wearing masks. And if we look at what's going on up at the top, you'll see the curves, and you can see that because people are wearing masks, they are not spreading the virus as fast, and people are getting infected at a much slower rate. The blue line is staying much higher than the previous case that we were looking at when people weren't wearing masks, um, and and the hospital load that is kept lower. Right, we flattened the curve, to use that phrase. And in the dots that are moving around, you can see that there's these little white rectangles on those dots, and that
Hmm.
represents the fact that that individual is wearing a mask.
Interesting. So if we go back and we bring it back to no one wearing a mask and
Mhm.
how that changed, then we end up having a very different curve, and that really changes the way that this is all going to
Yeah,
shake out.
yeah,
I
exactly.
and I guess the question is, where does that number have to be for it to make the biggest impact? We have 0 and we have 100, but there's certainly a lot in between.
Yeah, so on average, it looks like if you have by day 50, if you have the majority of the population, 80, 90% of the population masked up, then it tends to be enough to make a significant impact to, quote, flatten the curve. If you wait longer than that, say if you wait until day 75, then it becomes too late to make a significant impact because you've already allowed the, more than a majority of the population to become infected, and you can't arrest it anymore.
It's a question of where we are technically and what day we are, depending on where we're talking in the U.S.
Yeah,
In terms of infections. I really don't even know how many days we've technically been in this.
yeah, it's there are a lot of variations depending on initial conditions within a community. How many people were infected and at the outset, and uh, there's also a lot of stochastic noise in the system. What butterfly effects. Uh,
Hmm.
and so, maybe on this day, the guy decided to cross the street where he bumped into his neighbor and shook his hand. Maybe he didn't decide to do that. And so depending on that his neighbor either goes and infects an entire family and block or not, right? So you get a lot of this variance. One of the nice things about the simulator model is that you actually will witness that variance. If you run the same scenario over and over, you'll see, because of these butterfly effects, that even though we as humans would love to have certainty,
Hmm.
there isn't absolute certainty. It's all like playing the odds, right? And so, oh, if you do a lot of runs, you're going to see the tendency, and you have much better odds if you mask people up than if you don't have. But are you
So,
on day 50 today, or is it next week? Well, it kind of depended on what your neighbor did last month.
right. So, and I guess, the shelter in places that has changed the transmission rates too. So day 50, if in a place that is sheltered in place versus day 50 in a place that didn't have any kind of stay at home order, for very long, also changes a lot of, I think, the ability to change outcomes.
Yeah, and that's I want to underline a very important point. We don't want people to think that, oh, universal masking means we don't have to do anything else. It's absolutely critical that we continue the physical distancing, that we continue the testing and the tracing, um, and combine all of these measures with the universal masking to have the best odds of keeping things under control while the medical research community develops the vaccines and the treatments.
And let me ask you this. I mean, how reliable is this type of science in terms of predicting and showing and proving, in terms of, different officials and organizations looking at this and saying, okay, yeah, this is why we should be guiding or having this influence our decisions? People are going to say, well, how much is this proven to be true, that this simulation really is representative of what could or could not happen?
Yeah, there's a couple of things that I think are important to note. One is that it does depend on the quality of the masks. And so in the simulator, there's an advanced tab. I don't know if you want to show it
No,
on the
pull it up.
screen. Um, there's an advanced tab that lets you actually build your assumptions in about how good the masks are. So if you've asked your community to make this type of mask,
Okay.
we could actually, test the mask.
So this
Um,
is right here, right, in terms of what
yeah.
you're talking about. And let's expand
So
that.
under mask characteristics, there you see that there's
Oh, so
these
you can
two
change.
parameters on transmission rate. Yes. So you could, if you make your mask out of fish net, then you could set both of those down to 0
Yeah.
because they're not stopping any viruses in either direction. Uh, I think it is important to point out that transmission rates are different from absorption rates, especially if somebody's wearing one of those N95s designed for actual medical staff.
Right.
Some of them have an exhaler in them that is designed to let the doctor or the nurse exhale with no resistance. And they're just there to protect from absorption. Um, that will be of no use in terms of protecting your community from your potential viruses. And so that's why it's important to separate those parameters and see what happens. So you can build any assumptions that you like in there. You can have greater control over how quickly people are masking or unmasking. You can build different assumptions about the population density, numbers of infected, and so forth. So, in terms of simulator accuracy, um, you that will depend on how accurately you set these parameters with respect to
Yeah.
what masks you're building.
And there's so much,
Um,
it's confusing too, in terms of, if you take a city, you don't really know how many of these factors are playing in, what kind of masks everyone's using, unless you were the one distributing them. If we're all making our own and buying our own, then I think it also changes that as well, which is
that's
another added complication. Do you
yeah, and
feel like, yeah, since
here,
this has come out though and people can see this, what I like is, if you can do this advanced, you know decision kind of parameter setting, then it does one thing. But even if you can't, even if you just went down to the very basic, a lot of people are masking, or 0 people are masking, it gives you a pretty simple look at efficacy in this, in terms of when people are trying to decide, do I really need this mask or not?
yeah, and it gives you a good idea of how to improve our odds. Even if we aren't yet 100% certain that this mask is 60% effective, or it's 80% effective, or it's, like the thing is that overall, the tendencies, the trends are clearly there, right? And then you have to, if you're making decisions as a policymaker or just as a member of the community, you have to look at what the cost benefit, expected cost benefit is. And I think one of the things about masks is really important to think about is that it's all upside and not downside.
Right.
Um, all
Something is
like
better than nothing.
100%. Yeah, 100% of the countries that have been successful in suppressing the pandemic spread, not in East Asia, as well as Czechoslovakia and a handful of other countries, have had universal masking policies or cultures in place. 100%. And the countries that didn't have them all did not succeed. Now, of course, people say correlation is not causation. However, if you had to place a bet, it would be sort of insane to place a bet on the opposite side of the correlation, right? And so,
Yeah.
given how cheap it is for people to make masks at home, and don't take masks away from medical personnel who need PPE, it makes no sense not to take that bet.
Do you think that since this has come out, that you have you gotten any feedback or people who said, okay, you've convinced me, I wasn't convinced, or you have people reaching out saying this is something that we're going to use to maybe have a bigger discussion about what we're going to require and why?
Definitely, yeah. We've been getting a lot of feedback from this. People have been seeing this, especially after watching that video. And perhaps you can share the video's link with
Absolutely.
the viewer. It is really a good way to get people to, get away from the abstract discussions and philosophical stuff, and just go back to the basics and see. So if
Yeah.
I do this, that happens.
Absolutely. And I would imagine for everyone, I mean, I don't think there's anyone who doesn't want some semblance of a normal existence that was taken away from all of us, around the world with this model and this simulation. And I know you use Japan as a reference. The idea is if we all mask up to 80, 90, 100%, do you think things reopen faster safely? Because that's always the question. How do we reopen safely so that people don't get sick and that we don't have huge surges? And obviously you made the point that shelter in place, social distancing, all those are factors in how we do that. But do you think masks are critical to that?
I think it makes no sense to try to do that without the masks. There's a lot of pressure on the policymakers to reopen parts of the economy. Um, there is still a lot of risk. We are seeing second waves happen. We seeing it in Germany. We're seeing a little spike in Singapore for different reasons. Um, there is going to be a risk, especially if the testing and tracing infrastructure isn't yet in place. And there needs to be mass testing, and there needs to be mass testing repeatedly. And this is a conversation that we still need to have a lot more than we're seeing so far. But as those pressures are happening, if we're going to get out of a physical lockdown, I think it is far more preferable to lock down our noses and our mouths than lock down our full bodies inside our homes. Um, and so, in terms of discussions about the economy, about freedoms, individual liberties, I think it is important to understand that this is actually increasing um, our individual liberties, rather than being stuck in our homes the whole time. Yes, we still should stay 6 feet away from each other and wear masks, but it gives us a lot more freedom than if we have to take harsher measures.
Yes.
Uh, Again, that should be done only when we get the testing and tracing infrastructure in place.
There are absolutely a lot of moving parts, but any parts I think that get us back safely to the life that we all miss so dearly, I think is always good to take into account. Really, really interesting stuff. That simulator, very interesting to kind of play around with and take a look at and really put it in a way that we can all kind of digest that information and really take a good hard look at why throwing on that mask now doesn't seem like that that big of an ask, in many respects, in order to get us back to where we are. Well, Dakai, it was such a great conversation. Thanks for joining us from Hong Kong and the University of Science and Technology. And of course, we appreciate the work you're doing at Berkeley at the International Computer Science Institute as well. And so I appreciate your time.
Thank you very much, Claudine.
Such a good conversation. All right. And for more interviews, of course, you can go to coronavirusnow.com. Thanks so much for joining us.